So let's look at the radiotherapy timing part of the Radicals trial. Following prostate cancer surgery, radiotherapy may be used. This might be given within a few months of surgery in order to reduce the risk of the cancer recurring, or it might be used later to treat the disease if it does come back. Experts throughout the world are unsure which approach is better. Your own doctor shares this uncertainty, which is why you've been asked to consider the Radicals trial. So let's now watch Professor Kynaston, a surgeon, explain the aims of the Radicals trial to Mr. Parry, who has recently had surgery for his prostate cancer.
The aim of the trial is to determine whether giving you treatment now with the aim of preventing prostate cancer related problems in the future is better than or the same as waiting and just keeping an eye on the blood test and having treatment if the blood test changes in the long term. So it's either or really. Either have treatment now with the aim of preventing problems, or have a monitoring policy and only treatment if your PSA changes in the long term. Right, so that's the choice. Those are the two options, and in the trial, those are the two allocated treatments.
Well, that sounds the best one. The second one, wait and see if it gets worse or if it changes, and then carry on with the treatment. That seems the best. Then,
yeah, there'll always be pros and cons of each one of those options.
Yeah.
I think what we can say is there's no overwhelming evidence that one method is perhaps better than the other, but one may be. And there's some evidence that I could give you that, in fact, giving radiotherapy in the first few months after surgery may give possibly the best results. But it's not straightforward, and there is a lot of uncertainty about that. If we were certain or were very confident that one treatment or approach is better than the other, it really wouldn't be ethical to run a trial like this. And therefore we know that there's no definite evidence that one is superior to the other. And hence the need for a trial, and that's why it was developed.
Right.
Well, I don't think we can say which is the best way to do it comparing having the radiotherapy treatment now or over the next few months versus waiting and seeing and having it if the blood test shows a measurable level. I don't think we can say with certainty which is the best. And therein lies the dilemma. And the rationale behind clinical trials is to try and determine which is the best. And these studies require many hundreds, perhaps thousands of patients to go into these trials so that we'll know in the future which one of these options will be the best for men who are in this situation. For some patients who undergo surgery, they'll have a relatively low risk of needing further treatment.
Right.
For some men whose pathology samples show quite advanced tumours, then we know that they're very likely to require further treatment, usually in the form of radiotherapy and perhaps some additional treatment as well. But there's a group in the middle where we are uncertain whether that giving the immediate radiotherapy now is better than waiting and monitoring the PSA and giving treatment at a later date if we think it's necessary then.
So
you're in that middle group, the sort of uncertain group, that we're not completely sure it's best to give it now or wait and keep a close eye on you.
Yeah.
Maybe it's more important for me just to run over again the two main ways that we think about looking after people.
Yeah.
So we've got someone like you. You've had an accident operation,
Yeah.
and as far as we can tell, the whole of the disease has gone away.
Yeah.
But we've had a very careful examination of your cancer, and there is one feature that gives you a slightly higher risk of the disease coming back. So we are looking after you in a special way to keep a closer eye on you anyway.
Yeah.
And for people who have got a slightly higher risk of the disease coming back, there have been some trials suggesting that immediate radiation in your situation does appear to help keep the cancer away.
Okay.
But we also know that a lot of people in your situation are already cured from the surgery we've had, and
Yeah.
the trial is really trying to make sure we don't over-treat people too much.
But I'm not one of the ones that was completely cured.
Well, at the moment,
Well,
you've got a slightly higher chance than most of our patients
Yeah.
of being completely cured.
Okay. And the blood tests are okay? And
At the moment, the blood tests
yeah.
are correct and are very low, but certainly there is a risk that your blood tests will start coming back a little bit.
Okay. So when will I know if I've got to take this trial that you're talking about?
Well, today's appointment is to try to help you through that process. I mean, from our point of view, and from my point of view, and Professor Kinnison's point of view, the trial is a good trial for you. You fit into the category of patients that we're certainly looking to put into the trial.
Yeah.
And as soon as you are comfortable with what the trial's trying to achieve and with what treatments you might have within the trial, then we'll be happy as soon as we were sure you were really comfortable with things of you going to the trial almost straight away.
Okay. And the trial is either I'm in radiotherapy now or later. So do I decide on that? Or?
Yeah, so that's right. So the trial is either having radiotherapy starting straight away
Yeah.
or observing you for a period of time
Yeah.
and only treating you if your blood test goes up.
Okay.
As soon as you're comfortable to go into the trial,
Yeah.
then we'd ask you, once you've got the patient information sheet and you've gone through all the issues with it,
Yeah.
you'd sign a consent form. And you don't choose whether you have radiotherapy now or in the future, and I don't choose, but actually all the patients who are happy to go into the trial go into a pot of patients around the whole country, and then they are allocated either immediate treatment or deferred treatment by a computer system.
So I might not get it anyway.
So you might not get it, no. So patients in the trial, for everyone who goes into the trial, everyone who's happy going to the trial, and the doctors are happy for you to go into the trial, the computer allocates 50% of the patients, so half the patients to get immediate radiotherapy, and the other half of patients to go into the third arm where you're observed and only get radiotherapy if your blood test goes up.
So if I'm not picked to do the radiotherapy now, but my situation gets worse, then I start the radiotherapy.
That'd be right, absolutely.
Well, that sounds all right then, doesn't it? Because I'll get it even if I need it, I'll get it.
Yeah, that's right. So even in the third arm, sorry, go on, carry on.
No, I was just going to say I'll get it if I need it, and if I don't need it and I don't get it, I don't need it.
That's right. So in the deferred arm, if you don't get it straight away, but we've got any concerns that your blood test is going up, we would step in and go down with the radiotherapy as quickly as we could then.
Well, that makes me a lot happier, that does.
Okay. Well.